There's been lots of talk about vaccines, and it seems something that was very remote when this all started back in late February, March for us. But now we have vaccines on the verge of deployment, not just here, but in America and other parts of Europe. And I'm just going to ask Denise for her take on where things are at the moment and what its significance is for, in this case, for carers. Over to you, Denise.
Thanks, Brandon. I've got to say, I mean, we were so excited and hugely pleased and positive about the fact that we've now got 2 vaccines that look like they've got high effectiveness against the COVID-19 virus. That's absolutely fabulous news. And we're so glad to hear that all the work that's been going on with that has really borne fruit in that way. I think the concern that we have, though, is that although there is light at the end of the tunnel, it's not our solution for now. It isn't a magic bullet at the moment. We can't rely on it. It's going to be some way off until we start to feel those benefits. For example, we know we've already got parts of the health system that are coming together to look at the vaccination rollout and how that's going to operate, which is hugely exciting. But what we do know is that it's going to be going to, and quite rightly, to the most vulnerable people first. So that is older adults in care homes and older adults in general, and also people who work, key workers in settings looking after older adults. So it's going to the most vulnerable first. We're looking likely they're going to be getting it some point early in the new year, but it does mean that it takes a little bit of time also for that immunity to build in people that have received the vaccination. It's 2 doses. It's looking likely that will be the case. And actually, it does take some weeks for that immunity to build. So it isn't a quick fix that's going to work overnight from the first dose. So what we just need to be prepared for is this is going to go on for a little while longer. It's still, we do have that wonderful light at the end of the tunnel of knowing that we've got solutions coming. But what we've got to be really mindful of, that this isn't going to help us currently. We've got to be really careful that people still follow all of the guidance and advice. It's absolutely critical that people do follow the main 3 things, which is making sure they've got really good hand hygiene, so they're thoroughly washing their hands for 20 seconds as a minimum, or using hand sanitizer if they can't wash their hands. And particularly if they've been out and about somewhere, the first thing they should be doing is washing their hands when they come into the home. Second thing is to make sure they're wearing face coverings when they go out and about in indoor public places and on public transport. Really critical to protect the people around people who are wearing those face coverings, who do get benefits from the people wearing the coverings and protecting them. So really, really important that people do their bit by wearing face coverings. And the third one, and we can't emphasize this enough, and we are sounding like a stuck record in public health with this, but it is the social distancing. Keep your distance. As tempting as it might be to hug people, missing that is hugely difficult, but please do keep that 2 meters distance. It's critical in ensuring that we're reducing the transmission risk in our communities. So it's holding fast to those 3 instructions and key advice. In addition to that, it's making sure that if you are instructed to isolate, it's an absolute must that people do that, just that. They stay at home. They don't feel tempted to go out and about. Oh, it doesn't matter, I'm feeling fine. You never know when the virus is going to incubate in somebody, and it's going back to the situation where it's actually infectious 2 days before the symptoms come on. So it's that time where people are kind of going out and about thinking they feel fine when they actually should be at home isolating. And that's how this transmission is still continuing. So we've got to be really careful in emphasising the full importance of, if you've been told to isolate because you've been in close contact with somebody with COVID-19, that you do just that and you stay at home. As difficult as that is, it is incredibly important for us getting on top of this pandemic. So we need to keep all of that in train, because it's brilliant we've got the vaccine on the horizon, but it is not a solution for now, and it won't be a solution for a little while. So it's a case of keeping that positivity in our minds. We know we're on the home straight, but it's just making sure that we kind of hold fast to those messages and that advice until we get there.
Thank you very much, Denise, and thanks for all your information there. We've